Good afternoon. Thanks for this opportunity to present our work. So I'll start the presentation, then my colleague Cristina will step in for the funny part. And okay, so it happens in clinics that we need to stage the fibroid treatment because the fibroid volume is too big, or because we desire to reach near 100% of ablation in order to avoid reintervention. So we target half of the fibroid in the session, and then the other half in another one. And frequently, it happens that the non-target region appears non-perfused at the end of the treatment. As you can see here very well, sorry, and this imaging. Okay, we targeted the bottom part of the fibroid, and at the end of the treatment, all the fibroid was ablated. So currently, for the evaluation of the ablation, we use the NPV measurement, which is a non-perfused volume measurement based on contrast-enhanced T1 imaging. But well, what it doesn't do, the NPV is actually differentiate between ablation and vasoconstriction. So the clinical issue is that if the NPV is correct, and if is not correct, and we trust him, and it's wrong, the patient will be undertreated. Instead, if the NPV is correct and we're not sure, and we treat it again, then the then the patient will be overtreated. So, in the effort to answer to the question, does NPV accurately represent ablated tissue, we observe hyperintense contour on follow-up imaging, and we generate from that what we call black line volume. So the aim of our study was to compare the black line volume with a non-perfused volume, and to evaluate the accuracy of the NPV measurement as an estimate of the ablation, and to propose a new, more reliable predictive factor as a possible alternative to the NPV. So we have 5 patients with follow-up imaging. 4 of them were retreated, and so they had 2 sessions of treatments, and 1 had follow-up imaging after 43 days. And in 3 of them, we noticed reperfused region. And this reperfused region appears as non-perfused at the end of their first treatment. So we measured this non-perfused region, and we measure also their black line volume that we saw at the very beginning of their second treatment. And we measure also the NPV, and 4 of them we use the same methodology. We counter them, and we multiply for the slice thickness. So, and here are the results. Okay, so you can see very well the NPV at the end of first treatment, and the black line volume and the reperfused volume, and the elapsed stage between the treatment and the follow-up imaging. So almost 14 days instead for 1 patient, patient 2, 43, just because we have imaging as follow-up imaging scans. So now Cristina will explain better these results in depth.
So I will start the discussion from the first 2 patients that had no reperfused volume on follow-up. So as you can see here, we have the black line volume that in this patient is at least as large as the non-perfused volume at the end of the first treatment. But in patient 3, 4, and 5, we noticed something different. The BLV was smaller than the non-perfused volume. The reperfusion was observed on all 3 patients in follow-up images, and in all 3 patients, the black line volume excluded the reperfused volume, accounting for the difference in the measurement between the BLV and the NPV. Oops. So this is the example of patient 3. As you can see here, this is the planning of the treatment. So in the first treatment, only the posterior part of the fibroid was ablated. Was targeted. Nevertheless, at the end of the treatment, the NPV showed the whole fibroid as non-perfused. Since the MR thermometry did not predict ablation in the anterior portion of the fibroid, it was considered to be a partial temporary vasoconstriction, and the second treatment was targeting only the anterior part of the fibroid 14 days later. As you can see at the end of the second treatment, we observed a reperfused area, outlined in green, that importantly is in the posterior part of the fibroid, therefore was not targeted during the second treatment because was assumed to have been ablated. So how does the black line volume behave in these cases? This is the black line volume outlined in pink. As you see, the contour corresponds to the non-perfused volume, but exclude the non-perfused region. Therefore, if this image was used during the planning treatment, this under-treatment could have been prevented. For patient 4 and 5, we obtained similar results, with the NPV obtained at the end of the first treatment that overestimated about 420% the truly ablated volume, and the BLV predicted the reperfusion. So in conclusion, the black line volume correlates well with the non-perfused volume. In cases where non-perfused volume overestimated the truly ablated volume, BLV was a better predictor because it excluded the reperfused part. So therefore, black line volume may prove to be a powerful tool to reveal inadequately treated regions in the planning session of the second treatment, and therefore can prevent undertreatment or overtreatment. So as not all fibroids are treated in 2 sessions, we are now trying to determine how soon after the initial treatment the black line volume becomes visible. If further research demonstrates it at the end of the first treatment, then it may be used to allow a more complete ablation before contrast administration. Moreover, we are trying to determine the histologic correlate for the black line volume to better understand what this black line is. These patients all had a successful treatment with HIFU, therefore none of them underwent surgery, so we are waiting for more patients. We want to thank the Focus Ultrasound Foundation Global Internship Program that funded our research project, our mentors, and our project tutor. Thank you.
Any questions? No? I guess we'll move on. Oh, go ahead. Yeah, go.
On which pulse sequence did you see black line? Which pulse sequence of MRI did you see?
Right. We see it on the EPI sequence and TMAP sequences, so MRI thermometry magnitude sequences.
Great. Thank you so much.